Rebecca, thanks so much for joining me on the Journal Club today. Now, we're going to discuss a very relevant paper that was published in British Journal of Sports Medicine earlier this year. The paper relates to symptoms and return to play or return to sport after having COVID-19 in athletes. So it's a really interesting paper. They studied both the Paralympic and also the Olympic athletes in Great Britain who were going to the Tokyo Olympics. I think the data was kind of concluded in about February or March, but it was published in July. The paper describes some of the most common symptoms for the athletes. Now, fatigue was the most common symptom in nearly 60% of them. Then the next one was a dry cough and then a headache, both of those about 50%. Does this fit with your experience as well, particularly in the athletic population? Most athletes, no, I'll take that back. I was going to say most athletes are young. Most elite athletes are young. So would you say that that's very similar to kind of what you've been seeing in the general population compared to the elite athlete population?
At the beginning of COVID-19 novel coronavirus, yes. So I remember most of the cases quite vividly. Had a couple athletes right when we locked down, and they presented with that typical dry cough, the features that we were told to look for. As you'll know, the symptoms have evolved, and I spent last Monday morning looking at Omicron, and the different symptoms are very, very much like a common cold. So yes, it does fit. Yes, I and my colleagues have kind of held people back for training with common cold type symptoms and say, go get a PCR before you come into the environment, because we can't tell. And it's a bit of a dilemma as medics who study really quite hard and try to get symptomatology correct, but we haven't been able always to tell in this. Fatigue's very interesting. Fatigue during the acute phase of the illness, yes. So I have a couple of athletes who unfortunately were ill last week, but this week they're not fatigued. We do very slowly, we get them back into activities of daily life, then training. So, but that fatigue has been with the acute illness. What I think is also concerning, and that we have followed, is those who go on to develop long COVID. I don't believe that there's been a pattern that we've seen. Unfortunately, we haven't seen a lot of people with long COVID in the athlete population. But I guess for me personally, in my practice, it's probably hit about that 10 to 12% that is quoted of those that might, for whatsoever reason, develop long COVID. These are not athletes who trained through. These are athletes that kind of pared back, rested, but still have this ongoing fatigue. So I think sometimes a persistent fatigue will see less numbers, but a significant impact on their lives, especially if they're athletes and even if they're young.
You mentioned the fatigue. Fatigue's such a common thing in athletes generally, isn't it? I mean, they're always kind of training, particularly elites are training to their capacity. So as a doctor who sees athletes, if they do come in and just say I'm struggling with fatigue generally, like, would I assume that like a COVID test now would maybe be one of the first things you look at doing?
I think with fatigue that's persistent, if we don't know that they had COVID, we need to look for any other reasons. So before COVID, we'd look at other post-viral features, such as typically glandular fever that might cause it. But the tired athlete is a conundrum in itself, and we need to look at overtraining and under recovery. We need to look at things like iron stores. We also need to look at things like mental health and low mood that might be impacting. And of course, even with long COVID, some of these things can go in parallel. And there is a separation for sure between fatigue and mood disorders, but certainly if an athlete's been up at the top training regularly and has this pervasive fatigue where it's kind of hard to go get a shower, it's important to see what the impact on their own identity and perception of that is, and that they're not getting low themselves. But I guess what I'm saying in a roundabout way is that if we've got a fatigued athlete, we still need to do all of the things and all of the checks in their story and all of the other tests that we might think, not without applying sort of a clinical mindset to it, but to make sure that we're not missing something else in that athlete.
Yeah, that sounds very thorough. The paper kind of said, and again, I know it's slightly dated data, but the paper said that for even the athletes that had COVID, the average time that they were out of training and not playing was actually 18 days, which is pretty significant. I know that they call it kind of mild symptoms, and we all know that COVID can kind of hospitalise people and worse. But even for an athlete, taking them out for the best part of 3 weeks can really interrupt training.
Yeah, it really can. And at the beginning, and actually one of the authors on the paper, Dr. Hull, was very much instrumental in that initial return to training, because we were very worried about COVID. We'd heard about this inflammatory condition that might, even in its mild form, affect the heart and lungs. And there was really a 10-day step away from anything in terms of sport. The symptoms have evolved, changed, and we do have milder cases. The experience has evolved, and we have found, this paper does explain some of that, not a significant level of issues in terms of cardiac consequences or respiratory consequences in this population. And there has been a move to a more rapid return with medical guidance in some athletes who become, if they become well after 5 days, okay, they're isolating, but we can look at things like, say, keeping the heart rate fairly low, but a range of movement that they can get back into doing, so that when they come back, it's a steady return in. I'm still helping in elite sports guide each athlete with their coach into that, and it will be different for each one. So for example, I might have an athlete who's had cold symptoms, and after 5 days they're feeling good, so we can just do some gentle kind of walking pace. Once they're out of isolation, we can look to get them back into easy to moderate training. Monitoring heart rates, sometimes that's a really, really good indicator of recovery. But for another athlete, if they've still got symptoms of feverishness or cough, we're going to wait until those have gone. And I think that's really important to respect. Unfortunately, elite sport, we're always looking for the shortcuts, the quick wins. But I think in terms of health, the thing we've learned from COVID is that if we step down, step away, let the body recover initially, then we can get back in. But I think that 18 days average is kind of what we'd expect. You know, this is not a flu, but we'd expect it for a flu. And that's why we've really, really continued to work on prevention in the first place. Vaccines for the athletes, which was tremendous in terms of the ones going to the Olympics and the uptake from the athletes themselves, and now looking towards boosters, but also that prevention in terms of distancing and hygiene.
You mentioned two things there that just piqued my interest, and I'm just going to go off topic for 1 second. You mentioned vaccination and also heart conditions. I have spoken to some medical colleagues here in Australia, and we do know of we'll call it heart inflammation on this podcast, that can be associated with a small number of young men by having the Pfizer injection. Have you seen that, and is that something that if people are coming in with any cardiac symptoms after having those vaccinations, how do you deal with it clinically?
I've not, now that you're right, there is some, I don't know what the quality of the evidence is, but there are certainly some reports. It is low numbers. I haven't personally seen that. What I have seen is patients who've had COVID having pericarditis. So this is the same reported small amount of fluid, sometimes around the heart, can be caused by other conditions as well. So we have to look for some autoimmune conditions sometimes, but sometimes if the causality, we suspect we should really look into it. So I've seen it after COVID itself. So that helps us to weigh up, well, it might be a small risk with the vaccination. There definitely has to be more research done there, which I highly suspect is being looked into, but it is a concern. However, we know that people can get pericarditis after viral infections, including COVID. And I think something that I have seen, I'm not seeing cardiac conditions so much, but there is a set of conditions that kind of affect the central nervous system. So autonomic nervous system can be affected. And that's our way that we regulate heart rate and blood pressure. And again, it's not a known causation, but there are a number of athletes and a number of people who've gone on to develop what we call this long COVID, who've had dysregulation in that nervous system. And sometimes when I see that in an athlete, it will be a case of they're training moderately, they're feeling okay, but their heart rate's going really high. That really makes me look into it, work with the cardiologist, make sure it's not a heart arrhythmia. But in those cases, it appears to be more the central nervous system. Again, we don't know why. We know so many things we don't know everything about in terms of COVID. But I would say that association with long COVID is certainly something I'm looking into a case series with at the moment. So on balance, they'll say get your vaccine to athletes and the booster based on what we know and the safety that we know at the moment, for sure.
Yeah, no, that's fascinating. We're all just catching up as fast as we can to what's an extremely quick evolving situation. The other thing that I found really interesting about the paper was that there's about a quarter of the athletes developed what is colloquially known as long COVID. So in the paper that they had symptoms, they're out of sport, I should say, for greater than 28 days. And there was a high association with people who had long COVID who had symptoms in the chest, lower respiratory symptoms, chesty type pain, that type of thing. So was this unique to the athlete population, or again, this is what we're seeing in everybody?
I think there is probably a differentiation between long COVID, where sometimes people will have a mild course of the illness, they think they've got over it, but then this pervasive tiredness comes backwards and forwards, and then maybe lots of other symptoms. So I've seen everything from muscle aches and chest pain that I have not found a reason for in terms of heart or lungs or even musculoskeletal that we can scan, even to COVID toes, where people have toes that appear to have black areas on them, and that looks like some kind of vasculitic response. So lots of different things, but I don't think I've seen a direct correlation to long COVID and complicated COVID. So complicated COVID, I would say they've had the viral infection and they might get something on top of that, like a bacterial chest infection. Now, sometimes athletes can be at risk for that because they're training very hard. We know actually that training hard and being really fit up to a really high level is actually protective for the immune system. Just tipping over that level, it can make them a little bit immunosuppressed, but it's sort of right at the top, and mostly it's quite protective. But if someone's been hit by a virus, they can be at risk for a lower respiratory tract infection on top of that, for example. And of course, in parallel to anything that might be respiratory, in a small number of athletes, we do need to be vigilant for acute changes that are cardiac related, such as the pericarditis I mentioned, and a more severe form in most cases, which is myocarditis, a different condition, but inflammation of the heart muscle itself. So those who've had any complications of coronavirus would take longer. It would mean more tests, more checks that they're fit to come back when their symptoms improve.
And is that your prognostic indicator? If someone comes to you early and they've just, let's say they've been diagnosed and they have some symptoms, I suppose the number one question you would probably get is, how bad is this going to affect me? So is that something that you can, with some surety, kind of answer that question for athletes?
Oh gosh, it's crystal ball territory. It's hard. It was really hard at the beginning. And what we did when we locked down and before we opened up elite sports, so people could basically just come in and train and go home, was we risk stratified. So obviously I work with Olympic athletes and Paralympic athletes, and some people have underlying health conditions and some are what the government classed as vulnerable. So I was nervous. I think most healthcare professionals were, in terms of those people having higher risk. Fortunately, for some vulnerable populations, it's not always mapped out. So we thought those with significant asthma might be more affected, and some will for sure, but it didn't appear to directly always correlate. One great thing in English Institute of Sport is we've done a respiratory screening project before, so hopefully a lot of those with asthma had good control. So it doesn't always seem to be something that we can predict. Yes, I'm always concerned for people that have other health conditions for sure. We do seem to see that being physically fit helps with recovery from many things, but also from COVID. There have been a couple of papers, and obviously in an elite athlete population, that's significant because they are already really fit. I think what's changed, just fast forwarding to the end of 2021, I wish we weren't in the situation, but with the Omicron variant, for example, I'm seeing athletes who are triple vaccinated and unfortunately still getting COVID. However, so far, and I don't I think we're all losing a little bit of confidence in trajectories, but to maybe bring a little bit of hope, these athletes appear to be recovering really fast. So they appear to be recovering like within a week. We're still keeping the reins on their return into training, get them healthy first. But it does seem to be, some of them feel pretty ill, some of them got pretty bad, the cough and the tiredness in the first few days, but it does seem to be that they're coming back quicker than in that first wave.
Dr. Rebecca Robinson, thank you very much for joining us on the Journal Club this week.
That's a pleasure. Thank you very much for inviting me.